This stretch is meant to target two different muscles that cross the hip, and they cross the knee as well. These muscles are typically tight with patients with low back dysfunction, hip dysfunction, and knee dysfunction. So any one or a combination of all three of those types of dysfunctions can make these two muscles become tighter than normal. So the first one's the rectus femoris, which is one of the quadriceps, but it's the only quadriceps muscle that crosses two joints. The other three quadricep muscles cross only the knee. The other one is the tensor fascia lata, which comes from the pelvis on the side and front, and then it joins into the IT band. And the IT band is a very thick, wide tendon that has fibers that attach to the patella itself, as well as in front of the tibia. Okay, so I'll have you kneel down with your right knee on the pad and your right foot on the stool behind you. Now, we use two chairs because sometimes the pressure on the knee is uncomfortable, and with the patient locking their elbows like this, they can unweight by pressing their scapula muscles down toward their pelvis, and it can take load off the knee. The next thing we do to address the tensor, which is on the outside of the pelvis, is to move the knee underneath the midline. So if Kate then, don't go forward, but move it over that way. Pick up the knee and move it like that. And then the pelvis would be here. Now take the left foot and cross it in front of the right hip. Not that much, just right in front. Okay, now I would want the patient to look down at these two sharp bones that are located on the front of the pelvis and make sure that there is no torsion. That is to say, the right side that's going to get stretched should not be behind the left side. It shouldn't be torqued like this. That would be a torsion in the lumbar area that would cause risk. The other thing that we want to make sure is that these two sharp bones are level with one another. There's a tendency for some people that are tight that the pelvis on the opposite side is up, and we've got to prevent that from occurring. The foot that's out in front will have the knee slightly bent, and the sole of the foot out in front is flat on the floor. Okay, now as you can see from the view of the camera right now, the thigh is angled inward, and that's on purpose to try to address the tensor fascia lata on the side. And then the patient's asked to squeeze their gluteals, which will cause the pubic bone to rise in the front, as well as prevent hyperextension. We do not want to have any hyperextension. With the side view, you can see that we are trying to make sure that the patient is vertical at all times. They should not be leaning forward, but most importantly, they should prevent hyperextension and not lean their chest back and throw their pelvis forward. The low back would stay in mid-range, and we have removed the chair on the near side for a better view on the alignment. As the stretch is ready to be positioned, the last thing the patient does is squeeze the glutes, and as they do, the pubic bone rises in the front to ensure that no hyperextension occurs. And when they squeeze the glutes, which is a hip extensor, the antagonist of that muscle on the opposite side has a better opportunity to relax and make the stretch more effective. As the patient improves, then we would possibly place the rear foot on a chair so that the knee flexion would be greater, as they would then improve to stretch these two tight muscles to greater flexibility. Okay, if any pain is located around the kneecap that's sharp, the patient should address that with myofascial decompression with the cups as the most useful thing that they could do to get rid of any sharp pain around the kneecap.